Okay, so my name's Dr. Kate Barry, and I'm from the Holistic Health and Nutrition Clinic. You may already know that, but yeah, today I'm just going to talk a little bit about chronic illness and inflammation. So, why am I focusing on inflammation? I guess to me, in my clinical practice, the three things that pop up consistently as kind of general root causes for chronic illness are genes, digestion, and inflammation. Now, they're all kind of, I guess, as important as each other, but you know, inflammation can be coming from so many places, and so it definitely is one that's kind of at the top of my list to be investigating. Now, just to kind of explain my little diagram over here, you may have already heard this analogy of a tree and chronic illness. I'll explain it just in case you haven't. So the root causes of chronic illness are obviously represented by the roots of the tree. So you can see here that there are three large roots representing the three roots of chronic illness that I just mentioned. Soil is also very important in this analogy. So soil in the analogy would be kind of a you know, diet and lifestyle. So whatever you're putting into your body or the environment that you're in, and this can really, you know, have positive or negative effects on the tree. So you know, either feeding or starving the tree. So lots of interactions going on at this kind of root soil level. And whatever's going on there will then have downstream effects and flow-on effects to the branches and the leaves. And hopefully you can see here, these are all the kind of signs, symptoms, diagnoses at the branch level. So I guess the idea here is to show that, you know, while the branches seem to be the most important, you know, on a personal level, because obviously that's where all the suffering and comes from when you have these symptoms, they actually aren't the real problem. The real problem is what's going on at the root level and what is in the soil. So, you know, in my opinion, investigating and resolving the causes of inflammation is really crucial to optimal health and wellness. And I should just mention that inflammation can have, you know, as I said before, various causes. They can be internal or external causation. Internal, an example would be something like gut dysbiosis, and external would be something like exposure to environmental toxins. Okay, so just some of the talking points for today. I'm going to start with, you know, just a definition. What is inflammation? Give you a little bit of a general idea. You're probably aware, but I'll go into a little bit of detail there. Then I'm going to compare acute and chronic inflammation. I've got a little table where we can easily compare some of the main points. Then I'll switch over to really focusing on chronic inflammation. I'll talk about some of the contributors to chronic inflammation, some of the outcomes. So kind of an umbrella term for some of those diseases or conditions that can eventuate immune-mediated inflammatory diseases. And then I'll talk about some of the symptoms that you can look out for, at least the most common symptoms that I see in the clinic. And then I'll talk very briefly about two of the main conditions that I deal with in the clinic. There are so many others, but these are, I would say, the top two. So I'm going to go into a little bit of detail about those two. So hopefully that's helpful. And then finally, I'll talk about some tips. So 3 main tips to reduce inflammation. I've tried to make them ones that you can mostly do at home. So you don't necessarily need a practitioner for these, although a practitioner can be helpful. And then I'll talk about some extra support that might be helpful via some free resources, but also working with me at the clinic. Okay, so what is inflammation? So the best definition that I can find, the one that I like the most, is that inflammation is the immune system's response to an irritant. So an irritant can be many things, can be, you know, bacteria, virus, some kind of foreign object like is shown in this diagram. There's a splinter, or also an injury. You know, the most obvious and best example, I think, is when you sprain your ankle, right? And there's very obvious inflammation. And we've really known about inflammation for a long time. So the Romans described it thousands of years ago, and they talked about the four major components that we still describe today. So these are heat, redness, swelling, and pain. Okay. And all of these symptoms, all four of these symptoms, are actually due to an increase in blood flow or blood supply to the affected area, whether it's an infection or injury, whatever it is, more blood comes to that area. And you know, the advantage to this and the purpose behind this is that more white blood cells then come to the area, right? The white blood cells are in the blood, they come to the area and clean up that area and sort out whether it's an injury, damaged tissue, foreign object, or infection or toxin, whatever it is. And as a result of that immune system kind of being activated, there are also inflammatory mediators that are released. And these have many benefits, but two of the main ones is that are that kind of more, it's not just more immune cells that are coming to the area, but the inflammatory mediators actually make it easier for those immune cells to get into the tissues and have an effect. And also these mediators kind of irritate the nerves, and they cause pain signals to be sent to the brain. And the pain signals, you know, maybe you might think, what's the purpose of that? And really it's a protective mechanism. Okay, so it's, you know, so that if, you know, you can imagine if you have an area that is painful, then you tend to protect it so that the damage and the inflammation actually doesn't get any worse. So yeah, so that's just a basic understanding of inflammation. So now I'll compare acute versus chronic. Just very briefly, some of the features you can see here on the left-hand side of the table, and then the acute and chronic comparison here. So in terms of onset, I think it's relatively obvious that acute inflammation happens very quickly. It generally will happen in minutes or hours, whereas chronic inflammation is very slow, relatively speaking. It generally begins within days, but it can take much longer than that, you know, but definitely not kind of the minutes or hours scenario. In terms of cellular infiltration and what types of white blood cells are being utilized in these two scenarios, in the acute inflammation, it's mainly neutrophils. So these are the cells that kind of first come. They're very short-lived cells. And because they're short-lived, they are not very useful in chronic inflammation. So you kind of, there are more signals that go out, and the longer the inflammatory response goes on, the less likely it is that neutrophils will be the cells that are dealing with the inflammation, and it becomes more the job of macrophages and lymphocytes. In terms of tissue injury, it's quite mild, usually with acute inflammation. And the biggest or the most important fact here is that it's generally self-limiting. So what that means is that, you know, the inflammatory response ramps up as the white blood cells come in and start to kind of deal with the injury or infection. It eventually resolves and goes back to a baseline. In terms of chronic inflammation, that does not happen. It's often very severe tissue injury that occurs, and it's kind of progressive. So it's not self-limiting at all. It kind of runs away with itself a little bit. It doesn't come back to that baseline. Now, local and systemic signs, using the example that I talked about before with a rolled ankle or something like that, it's quite prominent, right? You can actually see physical signs, local signs, sometimes systemic signs if there's an infection, but they're quite prominent. Less so with chronic inflammation, okay? Less prominent, much more subtle. Sometimes there are external indicators. For instance, if you had kind of swollen joints on the hand, sometimes that's visible, but it's much less prominent than, for instance, that kind of redness and swelling and pain when you have a rolled ankle, something like that. Okay, so now I'm just going to focus on chronic inflammation. So chronic inflammation usually comes from acute inflammation that is unresolved. So it kind of moves into this longer term chronic phase. And it has a 3P process, I like to call it. So that is it's persistent, it's prolonged, and it's perpetuating. And I've got a little diagram here. I thought COVID's a really good example to use, quite a timely example. And, you know, so when you're talking about long COVID and the, you know, the people that unfortunately kind of develop long COVID, it's kind of an acute infection that, you know, turns into a longer term chronic phase, right? And we now know from the last few years worth of research that typically people with long COVID, I think the number was around the 80% mark of people with long COVID have these kind of inflammatory cytokines and immune cells in their blood that are measurable for up to 8 months post-infection. Okay, so chronic inflammation has been shown to be a really big component of long COVID. Okay, so contributors to chronic inflammation. This is just in a general sense. If you want to focus on these black kind of little pictures over here on the left, and these are contributors, and the purple ones are actually outcomes. I'll talk a little bit more about the outcomes on the next slide. So yeah, we'll just focus on the contributors for this slide. And what I think hopefully you can notice if you look at all of these is that the vast majority of them are actually diet and lifestyle, you know, things that you can actually change, a lot to do with things that you can change. So physical activity, diet, dysbiosis, chronic stress, disturbed sleep. So all of this area is diet and lifestyle. And you can see also that chronic infections can play a big part, and also xenobiotics. So xenobiotics is kind of just an umbrella term for things such as toxic exposures, chemical exposures, say long-term use of medications. So anything like that that's, you know, being put into the body, or whether accidentally or on purpose. And here are the outcomes. And as I said, I'm going to use a different slide, a different diagram to go through those. So these are the potential outcomes if chronic inflammation is kind of left unchecked, or, you know, not treated or resolved in any way. And I've just, this particular diagram groups them into the different kind of systems, I guess, of the body. So you can see that there are cardiovascular diseases, lots of examples, neurological disorders, metabolic disorders, cancers, bone and muscular disease, chronic inflammatory disease, and diabetic complications. And there's lots of different examples you can have here. This is by no means an exhaustive list, but just to give you an idea of how many, you know, chronic illnesses are actually based or have a very big component that is due to inflammation. The one thing that I think is really missing from this diagram is autoimmune disease. Now, there are some little kind of examples here. You can see RA and psoriasis, and even Alzheimer's is now shown, you know, that it can have an autoimmune component. But really, I think there should be a whole circle, because it is a very, they are very inflammatory based diseases. Okay, and I'll talk about them in a little bit more detail in a second. In terms of symptoms, so people are always asking me what to look out for with chronic inflammation, because as I mentioned previously, it's not always as obvious as acute inflammation, where there is very, you know, obvious external redness and swelling and pain. So what should you be looking out for? Look, to be honest, the list is really endless. It really depends on the person. So this is by no means a complete list, but these are the 6 signs that I find to be most common, you know, amongst the cohort of people that are suffering from some type of chronic illness. So the first one is persistent pain. And pain, you know, it really can manifest in many different ways. So it could be joint pain, and it can be very specific. So some people will have hip pain, some people will have wrist pain, some people will have elbow pain. Like, it's very different depending on the person. There can be like a neck or back pain. There can be headaches, or it could be even just overall body pain, just a generalized pain throughout the whole body. And one of the things that this can lead to, if left unchecked, in terms of, you know, a full-blown inflammatory condition, is rheumatoid arthritis, which is an autoimmune condition. The next one that's very common is fatigue. So this is really, you know, more than just being tired. It's a kind of exhaustion that, you know, is generally very obvious when compared to just a usual level of tiredness. Sometimes people describe, you know, being unrefreshed from sleep. Some people cannot, like, they have really poor exercise tolerance. There's lots of different ways that it can manifest. But yeah, and this can kind of, I guess, move into a chronic fatigue state if left unchecked. There is frequent illness is another common one. So, you know, if you're getting sick a lot, you're getting colds and flus, and some people I see have kind of recurrent tonsillitis or recurrent ear infections or recurrent bronchitis. So something that is kind of continuously happening, that really doesn't make sense, you know, and yeah, that is an indication that there's some inflammation, some chronic inflammation in the body. Another one is digestive issues. So this can be, again, a big spectrum. It can be just some basic digestive symptoms that a lot of people will just put up with and think are normal. So things like reflux, bloating, constipation or diarrhea, gas, you know, especially, you know, a lot of gas. So all of these things can be signs of inflammation. And then, you know, moving up to the other end of the spectrum, we would lead to things like inflammatory bowel disease, like, you know, colitis and Crohn's and things of that nature. Moodiness is the fifth one. So this, again, a spectrum, you know, can go just from feelings of low mood or irritability right up to, you know, diagnosable depression or generalized anxiety. And then weight gain is another, unfortunately, quite common one, particularly the stubborn belly fat. Sometimes it can be like a swelling or an excess water weight as well. And it typically is unrelated to diet and lifestyle. So what I often see in the clinic is people putting on weight, absolutely no change to their diet. Sometimes they're eating better to try and combat the weight gain. Sometimes people are exercising, you know, quite a bit, and they're just all of a sudden putting on weight that they can't control. That's another big indication that there is chronic inflammation. Okay, so I'm going to move on to my two examples. So the first one is autoimmunity. So I see a lot of people with autoimmunity in my clinic. It's a very common, especially because there are so many types of autoimmune condition. They're kind of all lumped into this one, you know, big category. So I thought I'd talk about it because it is so common. So there are three kind of prerequisites, I guess you would call them, in order to develop autoimmunity, full-blown autoimmunity that can be measured, you know, either in scans or blood tests. The first one is a genetic predisposition, and that predisposition is different depending on the condition, but there is generally a hereditary component. Then there will be an environmental trigger, again, varied. It could be an infection, it could be a toxic exposure, it could be chemicals or food sensitivities, but something, you know, external that triggers a response in the body. And then also leaky gut, or called, you know, more formally called intestinal permeability. And the thing about leaky gut is it's not just the leak, it's not really the leakiness of the gut that is, you know, directly that's the problem. It's the immune dysregulation that it causes. So hopefully you've all already heard of leaky gut. It's basically, you know, when undigested food particles sometimes even infections, just anything that's going through the gut can actually leak out into the bloodstream because of, you know, the cells or the moving apart and creating bigger areas to move into the bloodstream. And so, you know, undigested food particles go through there and they cause an inflammatory response or this immune dysregulation that I mentioned. Now, what causes leaky gut? Again, it's a huge list. One of the big ones is inflammatory foods. It could also be long-term use of medications. It can be other lifestyle factors like poor sleep, high stress, you name it, it can cause leaky gut. Okay, so these are the three things that are required to kind of develop autoimmunity. Now, what happens a lot of the time is that it goes unchecked. You know, so people are kind of develop the leaky gut, they have a trigger, they may even be slightly symptomatic and have some mild symptoms. A lot of people will mistake this for age. I have a lot of clients come to me and say, I just thought I was getting older, I was really tired, you know, I was starting to get a bit achy, and I just thought I was getting old. But actually, it's the autoimmune process, you know, progressing. And what happens in this progression is that you start with this kind of, you know, chronic inflammation, as I said, from foods or toxins or sleep deprivation, whatever it is, and you have the leaky gut and the gene. And if left unchecked, it kind of progresses to an overwhelmed immune system because, you know, you've just got this chronic inflammation and immune response just consistently happening and taking up energy. Then it becomes actual dysfunction. And this is where the body starts to have trouble kind of recognizing or distinguishing self from non-self, and starts, you know, this initial attack of something, some organ in the body, you know, with sometimes it can be the thyroid, it can be joints, it can be other organs. Okay, so and then you get full-blown autoimmunity if you know it kind of continues down that path. So that's kind of just a general idea of how, you know, the basics of autoimmunity and how it progresses, what contributes. I'm just going to shift to CIRS, mold illness now. So this is called chronic inflammatory response syndrome, otherwise known as mold illness or biotoxin illness. It used to be known as sick building syndrome. And this is a hugely inflammatory condition. And this is a very complicated diagram, so don't get too kind of caught up in trying to read it. That's not the point for this slide anyway. What I really wanted to get across is that over here with the blue arrows, this is the inhalation of biotoxins. Okay, so and it's showing you different pathways. So basically, if you go down the pathway down here, this is when someone doesn't have one of the genes that makes it difficult to detox. What will happen is they just detox the mold toxins, right? The mycotoxins. They just go through the liver, they get detoxed appropriately. But what happens if you do have one of these HLA susceptible genes that has been shown to you know, make it difficult for people to detox these mycotoxins, is you start getting this really complicated cascade of inflammatory events that happen. So it kind of starts up here, you know, you have the nerves affected, the surface receptors affected, the dendritic cells affected, and then you just have this flow-on effect that, again, if left unchecked, which it often is because people are really unaware that it's mold that's causing this, and you just, you know, you have huge effects on hormones like MSH, VIP, MSH, on the capillaries, which really affects your ability to exercise. You have inflammation-related symptoms here. You can sometimes get a resistant staph infection in the nasal passage that's really difficult to get rid of, changes in cortisol, gut problems, pain, sleep disturbances. So it's a really kind of complicated progression and can be quite debilitating if left unchecked, as I said. but all really based in inflammation around, you know, the inhalation of these mycotoxins and bacteria and whatever else is in a water damaged building. So in terms of symptoms to look out for, this is a list from Dr. Shoemaker. Again, he also had the biotoxin pathway diagram from the previous slide. So he's done a lot of research, he did a lot of research previously around this condition and the symptoms and the treatments. Now, this is, again, not an exhaustive list, but these are the most common symptoms that he found, and he's put them into 13 clusters. You can see the different colours. And the idea is that it should be relatively easy to figure out the likelihood that you are suffering from mold illness by looking at these symptom clusters. So if you're an adult, it's a little bit different for kids, but for adults, if you have at least one symptom from 8 or more of the 13 clusters, then the research shows that you are 95% likely to be suffering from mold illness, or from CIRS at least. So if this sounds like something that might be affecting you or a family member, or something that you're interested in pursuing, I do have a symptom cluster analysis form that I have designed really just as a free resource for people to be able to get an idea of whether this is a path they want to go down. So you can use this link here after the talk if you want to, and fill that out, and you'll get a response about the likelihood of CIRS for you, depending, you know, based on the symptoms that you flag. So that's mold illness. Now, in terms of reducing inflammation, so I'll talk generally, but I'll also kind of feed back to those two, you know, the autoimmunity and the mold illness that I just mentioned. So tip number one, and I guess it's quite a big multi-stepped tip, is to work on what I would call the 5 pillars of wellness. So these are nutrition and hydration, sleep and relaxation, exercise and or movement, depending on what you're able to achieve, stress and resilience, and relationships and networks. So focusing on, I'll leave nutrition to last. Everything else I think is relatively not easy, but simple to understand. So hydration, you need to be getting, depending on your weight, usually 2+ litres of filtered water per day. You know, you need to be having good sleep hygiene. You need to be doing some kind of relaxing activities. You need to be moving, even if you can't do, you know, typical exercise or kind of high intensity exercise, going for walks, doing gentle yoga or stretching, anything to just move the body is great. Stress management techniques, really, really important, particularly if you have stressful events that can't be avoided. And then just nurturing those relationships and networks, right? Making sure that they're positive and that you have support around you. And then coming back to nutrition, I think really there are so many different, you know, protocols that can be good for one person that aren't for somebody else. What I really promote is a whole foods diet. I think that's the most important thing. If you can stick to whole foods, very low processed is the biggest, you know, the most important factor. And then I would also say, when we're talking about reducing inflammation, you really want to be removing the top inflammatory foods, you know, and if you really want to move the needle, so these are things like gluten, dairy, and sugar would be the top 3. And then you have to kind of figure out what the others are for your particular body. Sometimes soy can be problematic, especially for people with autoimmune conditions. Sometimes eggs can be problematic, yeast. There's various different things, and you need to kind of figure out what they are to get the best diet for you. And these can really have a big impact on autoimmune conditions and CIRS. So removing all of the inflammatory stuff can really just give the body a little bit of a reprieve while working on the root causes, as I mentioned before. The second tip I would say is to support the gut. So as I mentioned, for autoimmune conditions, there is always this kind of leaky gut component. And one of the kind of complex stages in the CIRS journey is also about, there's digestive issues, and there's a hormone that kind of creates, it's not actually leaky gut, but it's very similar in how it presents. And so both of those conditions, or, types of conditions, we really want to be supporting the gut, but really anything, any chronic illness, anything where inflammation is a key contributor. And so some of the easy things that you can do at home without a practitioner, I would say bone broth is fabulous. So as long as you're not histamine intolerant. So, adding bone broth to foods, to casseroles, to curries is great. Drinking it like tea. It's got a lot of collagen and nutrients. You can also add other kind of mucousy type products like aloe or slippery elm. I would be adding those to a smoothie or something like that, because they're not great to drink on their own. Probiotic rich foods, so sauerkraut is a great one, kimchi, whatever kind of takes your fancy. And then the other thing that I think is often missed, that is quite a simple thing to do at home, is to really think about how you can optimize digestion in terms like behaviorally. Okay, so sitting down to eat, smelling the food before you eat to get those salivary enzymes flowing so that your digestion is primed. That will set off the stomach, the stomach acid and the digestive enzymes further on, and that's what you want to be happening. That will make sure that kind of motility is optimized, making sure that you're chewing your food properly, that you are spending at least kind of 15, 20 minutes even eating a meal, not 5. So all of these behavioral things are also really helpful to support the gut. And lastly, tip number 3 would be to reduce toxins. So I'm not talking about from a kind of big picture perspective, like I was talking about mold. That's a bit of a different story. I'm talking about the little things you can do day to day to reduce the level of toxins in your life. So things like filtering your water, buying organic produce or organic or grass-fed meats, using glass containers instead of plastic, and definitely not heating up plastic containers in the microwave. Choosing fish that aren't high in mercury, so minimizing tuna and such fishes. Not cooking with Teflon. Removing beauty products that have phthalates and parabens. So all of these things can be really helpful in just reducing the toxins and giving the body a little bit of a break. They may not be the primary root cause, but they will allow the body to kind of get into a bit more of a resilient state while you're searching for those root causes. Obviously very helpful when you're talking about mold illness, when it's, there is a major toxin that likely is the root cause, but also in autoimmunity, toxins are often part of the picture. So this can be really helpful. So if you need more support, as I said, I think a lot of those things can be done without a practitioner at home. Some people need a little bit more support even with those things. So especially with dietary changes. One thing you can do is register for the free anti-inflammatory cleanse that I run in my Facebook group. I run this quarterly. The next one starts actually in a couple of weeks. So if you're already a member of my Facebook group, which you probably are if you're here, then you can just click on the event registration and register there. If you're not, or if you kind of think, that this cleanse could be good for family or friends, then you can tell them to, go and request access to the group via that link, and then they can register in the event. You can work one-on-one with me at the clinic to see if it's something that you would be interested in. I think the best approach is to go to these 2 pages. They will give you an idea of how I work with clients, some pricing, all of the main things to see if it seems like it would be a good fit. And then I offer free 15-minute Zoom calls. So, you can do that via this link or on the website. and we can have a bit more of a detailed chat about you and what you need and what I think I can do or if I can help. And then I'm offering a 10% discount on all of my programs for anyone watching the webinar until the end of April. The coupon code is here. Again, if you know other people that you think would be helped by this, you're welcome to pass it on or let them know about the webinar and they can watch the recording later. And then just finally, just to give you a little bit of an idea, one of the big questions is always, well, what do we do in the program? And really, this is just a framework, okay? So everybody is different. Some people don't need as much detox support. Some people don't need as much gut health support. But this is the framework within which I work, which is basically diet and lifestyle, looking at gut health, so things like stomach acid and the microbiome and the gut lining, gut motility, possibly infections. We can do stool tests and, you know, if that's something that's necessary. I think nervous system support, stage 3, is one that's really missed a lot of the time. So this is kind of calming the nervous system. Typically, when there's chronic illness involved, people are often kind of stuck in this fight or flight response, right? And it's chronic. And we really need to move you into rest or digest. And the other thing is about retraining cyclical thought patterns. So again, it's a really common thing in chronic illness. You get into these kind of negative thought patterns about, you know, what's going to happen and, you know, how am I going to live through this and this symptom's going to get worse, kind of this snowball thinking. So there's lots of techniques we can use to calm that and retrain those thought patterns. So that's another big thing that I often work with. And then finally would be detox support. So this is quite a big area. We want to support the detox organs, open the detox pathways, and remove those toxic substances in the end. Very important, obviously, if we're talking about CIRS and mould illness, but even often the case, there might be heavy metals or chemicals, you know, that are involved here in autoimmune conditions.